Hey everybody, how you doing today? While my heart might be here, I'm actually working, and you know what time it is. Let's do a case study. Let's make it a venous one. The patient is a 63-year-old male, and we discovered an acute tibial vein and popliteal thrombus about 7 days prior. So this was a follow-up. The patient was being anticoagulated as an outpatient. He really had no other known risk factors. So here's a longitudinal and a transverse view of his popliteal vein. You can see it just above the popliteal artery. This confirms venous thrombosis. It is somewhat hypoechoic, consistent with acute or subacute venous thrombosis. However, what was quite striking were these multiple flow channels within the thrombus. So I'll show you a little video clip, and one can clearly see flow within the thrombus. Now, arguably, this is just recanalization. However, it looks rather pulsatile. We'll put a spectrum within there and sure appears to be arterial in nature. Go ahead and reposition the spectrum a little bit. So I believe that there is clearly arterial flow within this acute or subacute thrombus. Okay, how about a different patient? This person was approximately 1 month following an acute deep venous thrombosis in the femoral and popliteal veins. Again, in this case, we can clearly see flow within the occluded vein. The spectrum, in fact, proves that this is arterial flow. And how about one more? This patient is actually 4 days status post endovenous thermal ablation of the right great saphenous vein. They exhibit a similar neovascularization pattern within this dilated great saphenous vein. Since it's so dilated, we often suspect this likely contains some degree of thrombus. Note the extraneous noise. Apologize for that because we were using very low PRFs in order to detect the low velocity flows in this particular thrombus. However, there's clearly arterial flow within the vein, within the thrombus. Well, this was first described and reported by Labropoulos in an article published in the Journal of Vascular Surgery back in 2005. In a series of patients referred to their vascular laboratory for evaluation of deep venous thrombosis, they found 22 patients that had acute thrombosis in which they recognized multiple flow channels within that thrombus. The flow patterns was very low resistance, and hence they called this an arteriovenous fistula within the thrombus. Now, this is probably not accurate, and they did admit to the exact etiology and the natural history of that phenomena, or its clinical significance was really unclear at that time. If you'd like to read more, I'd strongly recommend what I consider the definitive paper on this, published in the Journal of Vascular Ultrasound back in 2007 by Catherine Bush. They described this phenomena as arterialized neovascularization, calling it small vessels with a low resistance arterial flow that appeared within this thrombus. Their series had a total of 50 consecutive patients that had either a deep or a superficial venous thrombosis. This arterialized neovascularization was present in 80% of patients and in 97% of cases with thrombus less than 1 year old. It was more common in patients with superficial venous thrombosis. In fact, 100% of those patients had it, and it was most prominent at the 2 to 4 month interval after the initial venous thrombosis. So their conclusion was this arterialized neovascularization was not an outlier or an isolated phenomena, but actually occurred commonly in association with venous thrombosis, and surmised that the arterialized neovascularization actually appears to be a normal component of the recanalization process and may result from an inflammatory reaction. So, as always, go out there and do right by your patients. And look for this. Just remember, this arterialized neovascularization may not jump out at you. You may have to spend a little extra time tweaking your instruments, setting your PRF right in order to see it. Go see what you can find. Hope you enjoyed this short presentation on arterialized neovascularization. Like, subscribe, we sure appreciate it. And if you need some CME, visit us at virtualveincenter.com.